Hello, my name is Dr. Bob DeMaria, the drugless doctor, and we're going to talk about blood sugar stress. Do you know that the third biggest killer in America today happens to be diabetes? This is very serious. Statistically said, any child born in that first decade of this new millennium, 1/3 have the potential to become diabetics, and that is not fun. I'm going to encourage you to talk to your healthcare provider and have an annual HA1C. The HA1C, or the A1C, is the amount of glucose on a blood cell over the last 120 days. Your goal is to have your HA1C within normal. Let's just say that you have high blood sugar. When I was first in practice, a blood sugar level above 90 back in the 70s was considered high. And today it seemed like they've moved the number up to 100. If your blood sugar is in the 90s, this is what I'm going to implore you to do. This is bread. Now, I'm not saying bread is good or bad. I consume minimal grain products. But this could raise your blood sugar, and that's what you want to avoid. What I would encourage you to do in the morning is start with protein. Maybe an egg sauteed with some vegetables. You know, it's okay even to have a chicken leg for breakfast if you'd like. You want protein in the morning. This happens to be a breakfast cereal. And any breakfast cereal, I want you to start looking at the ingredients on the box. They're loaded with sugar. You see, I know that right now, the average American is consuming about 28 teaspoons of sugar every day. I need you to become label savvy because you want to avoid all those added sugars that are so common in our foods today, especially if you buy boxed food. You know, the liver is really an important organ in your body to help control blood sugar stress also. It's a factory. It helps hold on to blood sugar. It releases the stored blood sugar in your body. You want to make sure that your liver is functioning optimally. You want to eat a half a red apple every day, a 1/3 cup of beet fiber, and 1 medium carrot. Take some milk thistle. Milk thistle promotes optimal liver function. You know what? There's an herb that promotes optimal sugar function. That happens to be gymnema. We use that a lot in our practice, and we've had great success with that. We also have used alpha-lipoic acid in our practice. That helps promote optimal sugar function also. But you really want to talk to your healthcare provider and have that HA1C test done, because that HA1C test is just a little bit of a roadmap of how your body is doing. And then finally, eat some protein during the day. This happens to be walnuts. And don't overeat your walnuts. Just eat some walnuts during the day. Maybe some almonds, maybe some cashews. They have protein in them, they have fat, but they help slow the release of blood sugar down in your body. Let me give you some drugless action steps. First, I want you to minimize all sweets in your life. That includes honey and maple syrup. If you just say no to it for a 3-month time period, use a couple of those items that I suggested to you, you'll be pleasantly surprised. Start your day off with protein. I want you to make sure that you switch soda with water. That's really, really important. And sidestep some of the grains that you're eating and focus on a green vegetable diet. I'm Dr. Bob DeMaria, the drugless doctor.